For the first time, guidelines have been developed for preventing stroke in women. As Doug Johnson explains in this month's Heart of the Matter, women share many of the same risk factors as men, but have unique risks as well.
Stroke, when blood is cut off from the brain, can cripple or kill. It's a serious problem for men and women, but it affects about 55,000 more women each year and kills more women as well. Because of that higher risk, there are new guidelines to help identify and prevent stroke in women.
Well, they were released earlier in the spring of 2014, and it was groundbreaking. It was the first time gender-specific guidelines were released. And they brought up a couple of key points. One is that women have different causes of hypertension earlier in their life.
That includes developing high blood pressure after getting pregnant, also known as preeclampsia. Other stroke risks that are stronger in women include increased exposure to artificial hormones like birth control pills, or having diabetes, depression, or emotional stress. Women who suffer migraine headaches with aura, that's a visual or other sensory problem, who smoke, are also at higher risk. And there's an additional risk for older women, having an irregular heartbeat.
A large risk factor for stroke in the elderly is atrial fibrillation. This is an arrhythmia which is very common in patients over the age of 70, but thought to be more common in women.
There are risk factors that women can control on their own, including watching their weight and eating a healthy diet to help manage blood pressure and diabetes, as well as tracking their sugar level if diabetic. Women should talk to their doctors about all the potential risks, no matter when they occurred.
Whenever we see a new patient in the office here, particularly women, we traditionally ask about that. You may be 70 years old now, but at some point we like to ask about pregnancy-associated hypertension. We now know that that carries with it as high as a 4-fold lifetime risk for developing high blood pressure, no matter your age of pregnancy, as opposed to your current age.
Last year, Heart of the Matter introduced viewers to Robin Clanton. She thought she was healthy, but suffered a stroke while on her honeymoon.
My words were jumbled. They were jumbled for like 24 hours. So that was really scary. But the whole time I was mentally aware of what I wanted to say and what was going on, but I just couldn't express it.
It turned out a medical condition Clanton had for years led to her stroke. She was with her husband, and they went to a hospital almost immediately after realizing something was wrong. Dr. Morrow says that in addition to knowing what the risks are, it's important to know what's going on if someone actually has a stroke.
A study that was released in the spring of this year, and they surveyed over 1,200 women. Most women were not able to identify the symptoms of a stroke. Up to 20% could not identify a single symptom indicating a stroke.
The groups that released the guidelines, the American Heart Association and American Stroke Association, also say knowing one word, FAST, can help spot a stroke.
I'm having a stroke.
Know the sudden signs. Learn FAST. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery.
Experts say awareness can save lives. For Smart Medicine, I'm Doug Johnson.